In our daily lives, we may encounter emergencies and incidents that demand an immediate response and action to save lives with a complete awareness of first aid steps. Here, Sarah is found unconscious. It seems that she urgently needs help. How can we deal with this situation? Her teacher, Nora, started to check the surroundings to make sure that the scene is safe. Then, she inspected the person's consciousness by shaking her shoulders and loudly calling her name and asking, "Are you okay?" to ensure that the person is unconscious. In this moment, the person should be laid on the ground or a solid surface. Remove away anything under her head. Open the airway by tilting the head back slightly and lift the chin. Then check for breathing for a period of 10 seconds by looking at the chest for any regular breathing movement, or listening over her mouth and nose for breathing sounds, or feeling the breath against the cheek. So, if there is no breath at all, or just irregular breath after 10 seconds, start cardiopulmonary resuscitation immediately. And do not forget to call or ask someone to call for an ambulance in the area. That is by calling the local number for emergency medical services. In case an automated external defibrillator (AED) device is available, as the first responder, send someone to bring the device. Begin cardiopulmonary resuscitation until the device is brought to you. Start performing chest compressions. Take a correct and comfortable position during the process by sitting on your knees against the chest of the person. Place the heel of your hand on the lower half of the person's chest, and the other hand on top of the first hand, with fingers interlocked. Position yourself so that your shoulders are directly over your hands. Your arms should be straight and tight. Unlock the movement of your elbows and shoulders. Chest compressions should be like this: strong, deep, and suitable to the age of the victim, between 5 and 6 centimeters for a person above 80 years old. Fast at the rate of 100-120 compressions per minute. Allow complete chest recoil after each compression. Minimize interruption between compression cycles as much as possible during the CPR for less than 10 seconds. If there is another first aider around, switch with him/her after 4 CPR cycles are completed, or every 2 minutes or upon exhaustion. After 30 chest compressions, get ready to give 2 rescue breaths, mouth-to-mouth ventilation. With the airway open, pinch the soft part of the nose closed and open the mouth, keeping the chin upward, then fully cover the mouth with yours. Take a breath, then blow steadily for 1 second until you see the chest rise. Move your head from the victim and look at the chest to observe the chest fall. The process would be considered effective if you notice the chest rises and falls. The interval between each breath should be 1 second. Give another breath. Repeat each round of 30 compressions with 2 breaths until the arrival of the AED device or the emergency medical services. When AED device is available, use it as it is without danger for the person and can save lives. Follow these tips. Start by taking the pads to attach them to the person's chest. 1 pad on the right side and the other on the left, as shown on the pads. Make sure not to touch the victim when the device initiates a quick analyze of the heart's rhythm, and wait for instructions. If the AED advises to deliver a shock, tell everyone to stand clear and make sure that no one is touching the casualty. Once clear, press the shock button. When the shock delivered, or if no shock is advised, immediately continue CPR. Do not stop giving CPR unless the person exhibits obvious signs of life, for example, breathing or consciousness, or when the emergency medical services or specialized paramedics arrive. Do not remove pads from the person, even if the person shows signs of life victim, until the arrival of ambulatory team or specialized paramedics. Everyone deserves the opportunity. Learn CPR and be prepared to save life. Contact your local Red Cross Red Crescent Society. World Restart a Heart, 16th of October and around every year. In cooperation with the IFRC Global First Aid Reference Center, GFARC, and Saudi Red Crescent Authority.